Epilepsy profile in infants with congenital Zika virus infection. To the editor. Congenital Zika virus, ZIKV, infection may have severe clinical consequences, including dysmorphic features, orthopedic abnormalities, ophthalmologic and auditory lesions, microcephaly, and hydrocephalus. When ZIKV infection is acquired in utero, it may be associated with epilepsy, and we characterized aspects of this complication in a study performed at our referral center. Patients who were referred to our center had congenital or acquired microcephaly, were asymptomatic or symptomatic newborns who were born to mothers who had confirmed or suspected ZIKV infection during pregnancy, had calcifications, not related to other in utero infections, that were detected by means of neuroimaging studies, or had an unexplained developmental delay and lived in geographic regions where ZIKV infection was epidemic. See Table S2 in the Supplementary Appendix, available with the full text of this letter at nejm.org. Our study included 141 infants, 54.6% of whom were girls, who had congenital ZIKV infection that was confirmed by laboratory analysis. The mean age of the patients was 9 months, range 1 to 14. Serum samples obtained from the infants and their mothers and samples of cerebrospinal fluid obtained from the infants were tested by means of quantitative reverse transcriptase polymerase chain reaction assay for the detection of the ZIKV genome and by an IM antibody capture determined by enzyme-linked immunosorbent assay. In all the infants, structural brain abnormalities were detected by means of neuroimaging studies. The study was approved by the Institutional Review Board of our referral center, and written informed consent was obtained from the parents of the infants. The study protocol included a clinical evaluation every other month and immediate assessment in case of the development of unexpected clinical complications. The parents were interviewed with the use of a questionnaire that addressed clinical variables associated with epilepsy. Medical records, electroencephalography, EEG, video EEG, and videos from the families of the patients that documented seizures corroborated this information. Seizures were classified according to the guidelines of the International League Against Epilepsy. Table 1. Clinical and electroencephalographic findings associated with congenital Zika virus infection. The prevalence of epilepsy in this cohort was 67%. And the mean age of the infants at the onset of epilepsy was 4.9 months. Data from the parents of the infants indicated that the seizures occurred during the first 6 months of life in 74% of the infants. At the onset of epilepsy and during follow-up, the main seizure types were epileptic spasms, in 72% of the infants, focal motor seizures, in 21%, and tonic seizures, in 4%, Table 1. A single seizure type was documented in 77% of the infants. All infants with epilepsy received anti-epileptic drugs, and 56% received polytherapy. The last evaluation showed that remission was achieved in 62 infants, 65%. Of these infants, 24 received monotherapy, 39%, and 38 received polytherapy, 61%. The use of vigabatrin, levetiracetam, valproate, and phenobarbital appeared to be associated with improved seizure control. The main EEG patterns detected in the patients are listed in Table 1. The presence of a classic or modified hypsoarrhythmia or a burst suppression pattern was associated with drug-resistant epilepsy. All patients with hypsoarrhythmia had clinical spasms that were characteristic of the West syndrome. A burst suppression pattern was not associated with tonic seizures. Remission occurred in one patient in the group of patients with a burst suppression pattern or hypsoarrhythmia. The prevalence of epilepsy in this referral center-based cohort was higher than in previous series in which the prevalence ranged from 9 to 50%. 1-4 In our study, patients had early onset, often drug-resistant, epilepsy. The background was abnormal in most EEGs, as previously observed. 5 However, some EEG features, such as a burst suppression pattern and hypsoarrhythmia, were predictive of severe epilepsy. Epilepsy may complicate congenital Zika infection. Helio van der Linden Jr., MD. Dr. Henrique Santillo Rehabilitation and Readaptation Center, Goiânia, Brazil. Maria de Carvalho, MD. Oswaldo Cruz University Hospital, Recife, Brazil. Vanessa van der Linden, MD. Association for Assistance of Disabled Children, Recife, Brazil. Caline M. Lacerda, MD. Oswaldo Cruz University Hospital, Recife, Brazil. André Pessoa, MD. Hospital Infantil Albert Sabin, Fortaleza, Brazil. Mara El Carneiro, MD. Dr. Henrique Santillo Rehabilitation and Readaptation Center, Goiânia, Brazil. Marli T. Cordeiro, MD. Centro de Pesquisas Agios, Recife, Brazil. Ket de Valente, MD, PhD. Hospital das Clínicas de Faculdade de Medicina da Universidade de São Paulo, Brazil. ket.valente@hc.fm.usp.br. Disclosure forms provided by the authors are available with the full text of this article at nedm.org.